Who's got experience out here clinically using this drug? Do you at all?
Well, again, the size of experience, we had 11 patients on the study, which is very few compared to the other places, but we're in the United States. But our experience was, is similar to what's been stated. It was very well tolerated. There's some bone pain is probably the main thing, and often the bone pain reduced significantly after the first 3 or 4 doses. In our practice, where we have a moderate number of thalassemia intermediate patients who we have on transfusion, therefore they are transfusion dependent. I mean, the first patient on this whole study was in our group, as you probably know, the very first patient, and he is not off transfusions, but he probably could go off transfusions.
So let me see if I hear what you're telling me. This luspatercept, well tolerated, subcutaneously every 3 weeks, you said? We spent the first part of this discussion saying how everybody needs to be transfused all the time to keep these hemoglobins up, to keep erythropoiesis down in the marrow. Suddenly I'm hearing, give them luspatercept, and there are fewer transfusions and maybe none?
Well, that depends. Again, we have to come back and say, this particular patient, patients who are thalassemia intermediate patients,
okay,
who are being transfused, and this particular patient, for example, he's now 28, but I've taken care of him since he was an infant. He's a thal intermediate who we placed on transfusions when he was 11 because he wasn't growing, but his hemoglobin was 8.5.
Okay.
We put him on transfusions, and his linear growth increased. He did much, much better. So this is not a beta-0 patient, as Sujit is talking about. He's a beta plus, or beta-0, beta plus combo, or something like that. And so I think this group of patients is probably particularly going to benefit from this.
The intermediate patient.
And we don't really know the study says do it every 3 weeks, but we're hoping that they'll benefit from being able to do it less often.
I have to say that the BELIEVE study, the one who was approved for the registration, is on transfusion dependent. But there is an ongoing study in non-transfusion dependent. We don't know officially the data yet because it will be open next year. But it's fun to deal with patients on this trial because they come and say, listen, you are blind because the study is blind, so we don't know which kind of arm they are, placebo, and they come and say, you are blind, I'm not. I'm feeling completely different. I'm feeling well, I go to the gym.
Right. What are the endpoints, the formal endpoints of the study? Of the one we
BELIEVE
the BELIEVE study.
A reduction, so the primary endpoint was a reduction in transfusion requirements of 33% or greater, a third or greater, during a specific interval between the 13th and the 24th week of the study. And then the secondary endpoints were reduction in transfusion requirement at any over later time points, 37 to 48 weeks, and then a 50% reduction at those same time points. And then there was another one that's looked at a sort of rolling endpoint of any 12 weeks to see whether there was a reduction in transfusion requirement or not. And all of the study endpoints were met, statistically significant and met.
And the last point Sajid mentioned, so the evaluation at any time during treatment is underlying the fact that not all the patients are the same. Patients have different grade of ineffective erythropoiesis, and they may respond in a different time during the first year of treatment, and then they can be stabilized. So I think it's quite challenging.
It's an encouraging study at this point.
Very encouraging.
Encouraging.